is decided by the rule 2. So now we see performance evaluation parameters, percent, segments, moderate weighted kernel function defined by equation 8. And to 61.08%. IMFs can provide good detection performance for rule-based detection of the epileptic seizure from EEG signals. Professor Ayman. Am I audible? Okay. So now this third part of this epilepsy diagnosis is epileptic seizure detection algorithm. That is actually very important for real-time detection of the epilepsy. So detection of epileptic seizure based on visual inspection of EEG signal is very time-consuming and may be inaccurate, particularly for long data recordings. And when a seizure occurs, the automatic seizure detection method can help in providing immediate required treatment for epileptic patients. So the studies area which measured from the trace of the window dynamic IMFs of EEG signals can provide rule-based detection of epileptic seizures. So the EEG signals which dataset which is publicly available at the University of Freiburg, Germany has been used in this work. So actually sometimes when you want to detect epileptic seizures, then the data that you have that is used. So it becomes manual method don't work. So there is a need of automatic method, signal processing approach to detect the epilepsy in real time manner. So the data set contains invasive EEG recordings from 21 patients suffering from medically intractable focal epilepsy. So there are two kinds of epilepsy. Focal epilepsy, actually they make the specific reason and they are always originated from that. And generalized seizure, they can go anywhere in the brain and they can be detected from the EEG surface EEG signals. But when you have focal epilepsy, 70% cases, 80% cases, they are drug resistant epilepsy. So this medicines doesn't work. Then you have to actually detect the reason for surgery, for the surgery. So that we record intracranial EEG, they have actually high signal to noise ratio, and then actually we perform this actually surgery and to remove that part which is responsible for the this focal epilepsy. So the EEG data were acquired using digital video EEG system with 128 channels, 250 Hz sampling rate, and 16-bit analog to digital converter. So in this study, the 3 intra-source records of 9 patients with focal epilepsy originated in the temporal lobe region has been selected. And this computes total of 90 segments per each channel, 51 of them without epileptic seizures and 39 segments denoted as having only one epileptic seizures. So now we will see some results. So this is the EEG signal, which has episode in the middle. And if you decompose using EMD method, then you see this first IMF, first 3 IMFs. And it actually, when you decompose, then this activity is boosted up by the different IMF, different scales. You can see them in better way. Then once you compute area, instantaneous area of these IMF, first IMF, second IMF, third IMF, then actually you can see how this actually how it is actually becoming severe. So in the beginning, initially it increases and then actually becomes very high. So that initial stage can be used to predict the epilepsy. So here you can see the dotted line that you see beginning and ending. That is actually why the neurologists have provided us these boundaries based on their approach. So that this is the reason for the epilepsy. And these circles that actually beginning and ending, these circles in all these 3 cases, they are detected by our proposed approach. So this actually that is a so it is clear from these results that our proposed method of this detection of seizure in real time is actually supporting with the neurologist approach. So there is validation. So it can be used an alternate of the neurologist to detect the epilepsy. So epilepsy detection based on the instantaneous area of IMFs has been performed by the following decision rules. The first decision rule includes the computation of threshold of each area of IMFs of each signals of all channels, and the threshold of the mth IMF is computed by the equation 11. And second decision rule requires the identification of those seizure activities which are present in at least 2 of the 3 area of IMFs of each channel. And finally, third rule requires making an inter-channel decision by identifying those seizure activities which are actually available in at least 2 of the 3 channels, where presence of seizure activity in each channel is decided by the rule 2. So now we see performance evaluation parameters, patients, segments, true positive, true negative, false positive, false negative, and then sensitivity, specificity, positive particular area, and negative particular area, ERD, error rate detection. And this mathematical expressions, sensitivity, specificity already have been provided in the earlier slides. For PPV, NPV, and ERD, one can see in the bottom of the slide. And when you see this in the slide, just 1 minute. So here we can see am I audible? Oh, thank you. So actually, these sensitivity, specificity, positive predictive value, negative predictive value, these all should be higher. So you can see in the proposed framework, they are becoming higher, and ERD, error rate detection, that parameter should be lower and it is becoming lower. So we are getting actually our whatever desired results for this epilepsy detection. And so then we have compared our method with the other existing methods in the literature. So Orozco and others 2009, they suggested use of energy of IMFs of these signals, and they got sensitivity, especially positive and PV, and that is in this table one can see, and EID is also there. In Korea and others in 2009, they use energy of each signals, and the parameters, computer parameters are as follows. And the proposed method, that is actually instead area measure of analytic IMS for each signals, which gives sensitivity that is 90%, that is higher than the other existing two methods, 89.31%, which is higher than the other two methods, 89.81%, that is also higher, 93.7% is also higher, and 24.25%, that is lower than the two methods. So that is actually we are getting results which are very supportive and in the favor of the proposed framework. So that can be used as actually as a tool for the epilepsy detection. And in actually many countries, people they wear electrode cap, and that is actually, and they monitor EEG signals, record EEG signals, and they apply such methods. So once you detect the epileptic seizure, then they, for example, they are driving a car, they can stop the car and they can then take the epileptic drugs and they can bypass the attack. So that is very useful tool. So after that, there another framework, that is actually method, that time frequency image based features for classification of sleep stages. So the EEG signals, they are commonly used signals for classification of sleep stages. So classification of sleep stages is a multi-class classification problem and very useful in the diagnosis of sleep disorders. So a standard method for sleep recording and manually sleep staging is based on the criteria proposed by the RNK method. And according to RNK standard, sleep actually contains 6 different sleep stages: wakeful, awake, non-rapid eye movement, S1, S2, S3, S4, and rapid eye movement. So that actually 6 sleep stages are there. And then another method of sleep stage developed by the American Academy of Sleep Medicine, which combines sleep stage S3, S4 of RNK standard into single stage known as slow wave sleep. So in that, according to RNK standard, there are 6 sleep stages, and according to American Academy of Medicine, there are 5 stages. So we have to classify each signal into these stages. That is very challenging task. And this actually like rapid eye movement in India, that is like it's very useful stage, and that is known as Brahma Muhurta time, like morning through to 5 o'clock. So that actually is responsible for the dreams. So like and different dreams actually people interpret in the different ways. Like if you have seen the dream in the night to 12 o'clock, and if you say in rural area that I have seen dream at 12 o'clock, then they will not take it seriously. But if you tell that this dream I have seen at 3 o'clock or 4 o'clock, then people will take it seriously. It may be informative, it may be correct also. So if you see in the old time, like Ramayana time, Mandodari, actually I've seen in the dreams that Ravan is going to die. That actually, so a lot of information sometimes you used to get in the dreams. And there is a lot of research is going on, and they're interpreting actually this information, whatever you see in the dreams, that with the real life actually those concepts. So this manual method of classification of sleep stage is a very time consuming task and prone to inter and intra-score variability. So moreover, the manual sleep scoring is performed by trained professionals and clinicians. The reliability and agreement of manual sleep scoring may be unsatisfactory because of subjective judgment and possible human error. So due to all these reasons, there is a lot of interest in the literature to use signal processing and machine learning techniques to perform the classification of these sleep stages. So these are proposed methodology. We have EEG signals, sleep stages, S0, S1, S2, S3, S4. According to RMK standard, 6 stages are there. Then we obtain time frequency representation using pseudo Wigner-Valley distribution method and segmentation of time frequency image of EEG signals based on the frequency bands of rhythms. And this time frequency distribution represents the energy of the signal as a function of time and frequency. So energy is positive quantity, so it can be converted into image. So we get time frequency image, and then we segmented this time frequency image of based on frequency bands of rhythms. Then features based on the histogram of some images of the EEG signals are computed. Then we are given these features to multi-class least square support vector machine classifier. Then it will give you awake S1, S2, S3, S4, S4. These different classes of EEG signals can be classified. So EEG database for sleep stages. The EEG dataset which is publicly available online at PhysioNet site that is used for this study purpose. And the recording are obtained from 8 males and females whose age vary from 21 to 35 years old without any medication. The recording contains horizontal EEG signals which sampled at 100 Hz, and according to RMK standard, the EEG signal data will be divided into 30 seconds epochs and total of 4,700 epochs, which is 350, 310, 2,220, 510, 480, and 830 epochs from our S1, S2, S3, S4, and RMC stages respectively, and have been selected for PZOZ channel during the 12 o'clock to 5 o'clock. So this time actually 12 o'clock to 5 o'clock time is like 5 hours time. This all 6 sleep stages can be covered. So now we will see results, time frequency representation using smooth pseudo Wigner-Valley distribution method. So the mathematical expressions can be seen in equation 11, and that actually it can be converted to time frequency image here using the smooth pseudo Wigner-Valley distribution of REM sleep stage of each signal. And then we have segmented this gray and binary sub images into different rhythm, delta, theta, alpha, beta, gamma rhythms. Then we have actually a computer histogram of these gray and binary sub images of time frequency corresponding to frequency bands, delta, theta, alpha, beta, gamma rhythms. And then these features, maximum count of pixel intensity histogram by equation 12, spread in the histogram, this sub image by equation 13. And aspect ratio in the histogram of binary subimage defined by equation 14. And now these features, once you have obtained these features, now these are actually now this is a multi-class classification problem. So this multi-class least square support vector machine classifier is used for the classifying. So multi-class classification is multi-class least square support vector machine is defined by the equation 15. And here we need actually kernel functions which are multi-class. So in this work, following kernel functions are used. Radial basis function for kth class is defined by this equation 16. Where sigma can control the width of RBF kernel, and Mexican head wavelet kernel function can be defined by equation 17. Molet wavelet kernel function defined by equation 18. Now here you can see experimental results. So without segmented time frequency image, with segmentation of time frequency image. So when you segment time frequency image, then actually there is huge improvement in the classification performance. So without segment time frequency image, for example, if you consider Morlet, then you are getting total accuracy 79.99%. But when you are doing segmentation of time frequency image, then you are performing classification, then same kernel function is giving 92.93%. So it is huge improvement. So it motivated us to perform the classification using time frequency image segmentation in terms of rhythms. And this is a confusion matrix, automatic score confusion matrix can be seen for the classification accuracy of the sleep states of each signal for Morlet wavelet kernel with window size of 64 samples. And then we have compared actually our method for the classification of sleep stage RMK standard. Dorosenkov and others 2007 with FFT based features in the Markov model. And they got different accuracy can be seen. They were in total 61.08% accuracy. Burale and others 2010 used hybrid features and cluster-based classifier PCA and got 69.98% accuracy. And proposed method, time frequency image-based features and multi-class least-square support vector machine classifier, they got 88.47% accuracy. And the individual classes accuracy also can be seen by this table. And American Academy of Medicine, very less work is done. So Wusu and others to 2013, they apply energy-based features and Lemon neural classifier got 87.20% classification accuracy. And proposed method, time frequency image-based features and multiplied support vector classifier got 92.93% classification accuracy. So that is actually still there is a lot of opportunity to improve the classical performance. And last part of this talk is on multi-wavelet transform-based features for human emotion classification. So EEG signals actually contain valuable information related to different emotional states, which help us to understand the physiology and psychology of the human brain. And the emotions measured by EEG signals more advantageous because it is difficult to influence electrical brain activity intensely. So like if you emotions generally people measure based on the speech signals, based on the face images, they can be manipulated. So emotion classification using EEG signals can help us to develop and improve brain computer interface system. And the BC system can be used for assisting the physically disabled people and impaired people to interact with the real world. So this is the proposed methodology. We have experimental setup, pre-processing, multi-wavelet transform, and Euclid distance-based features from 3D phase space reconstruction, and multi-class support vector machine classified, and happy, neutral, sadness, and fear, these emotions are classified. So the EEG signals were collected from 8 healthy subjects, 4 males and 4 females, whose age vary from 20 to 35 years during audio-video stimulus. And these subjects were undergraduate students or employees from IIT Indore, and 16-channel EEG module in compliance to the international 1020 system was used for recording of EEG signals. The sampling rate was 1000 Hz of the EEG signals with bipolar montage for this study. And this study has examined 4 emotional states, which includes happy, neutral, sadness, and fear. And this experiment 3 audio-video stimulus with 5 trials of each emotion from 8 subjects with F3, F4 channel of each signals are used. So total 480 signals were used with 2-second duration, and that can be this electrode cap, so the location of the electrodes, and this actually the arousal and valence diagram for the considered emotions. This is a complete actually methodology. So the subject is watching video from that emotions are generated, and they are recording the terms of EEG signals, and then we perform pre-processing, non-stationary decomposition, and we extract features and perform the classification. So multi-wavelet transform, this also actually it was advanced the signal processing technique, and it is an extension of the idea of scalar wavelet, where multiple scaling functions and associated multiple wavelets are used instead of a single one. The multi-wavelet offers the advantages like simultaneously expert orthogonality, short support, symmetry, and second order approximation. And 3 commonly used multi-wavelets are employed in our work: GHM, CL, and SF4. And the concept of phase space is actually important tool for characterizing high dimensional dynamic systems. And in order to extract the non-linear dynamics of the subband signals by multi-wavelet decomposition, we have used phase space reconstruction. And the phase space reconstruction of subband signals can be expressed mathematically by the following expression. And this is actually one of the examples where 3 third level, so there will be 4 subbands, and there in phase space reconstruction plot can be seen. So they shows the actually variability it changes variability with respect to the emotion, and we have quantified this variability in these plots phase space reconstruction using mean of equivalent distance and standard deviation of equivalent distance. And then actually the proposed method, the GHM, CL, SF4 multiple have been studied to for the third level decomposed subsignals of the EEG signals. And the PSR of subsignals is more useful for higher dimensional representation, which help us to compute the equivalent distance based features from decomposed subsignals obtained by multi-wavelet decomposition of EEG signals. And the mean standard deviation of equivalent distance of 3D PSR is summarized the complexity of the decomposed subsignals, which is linked with the different emotional states of the brain. And these features have been used as an input to the multi-class support vector machine classifier with the RBF kernel, Mexican head and Morley wavelet kernel functions. And now we'll see the results. So the multi-wavelets GHM, SF4, CL, and this kernel functions and parameters, they are obtained based on trial and error. And happy, neutral, sad, and fear emotions results can be seen. And total accuracy If you see the CL multi-wavelet with Molet wavelet kernel function, it gives you the better performance. This is a confusion matrix for the steady classification problem. And then we have compared our method with other existing methods in the literature for classification of motions. So linear others 2010, they use music of 30 seconds with 24 channels. They use short time Fourier transform with K nearest neighborhood and linear discriminant analysis classifier. They got 82.29% accuracy with 4 classes emotions that we have studied. When others 2010, they use video of 4 seconds, 62 channels, minimum redundancy measure of impedance. And they support vector machine. We got 66.5% classification accuracy with the 4 classes. In the proposed method, we audio video of 2 seconds with one channel multivariate transform. We have multi-classified vector machine classified, but 91.04% classified accuracy with the 4 classes. So this is the conclusion of this entire talk. The area measured from the trace of the analytic IMFs, which have circular form in the complex plane, can be used as a feature in order to discriminate normal and epileptic seizure EEG signals. The bandwidth parameters, bandwidth to AM and bandwidth to FM of the IMF EEG signals can be used as feature in order to classify seizure and non-seizure EEG signals. The classified results values have statistical parameter indicated that the Morlet wavelet kernel function of LSSBM classifier has provided higher classification accuracy in classification seizure and non-seizure EEG signals. We have proposed a patient-specific system for detection of epileptic seizures from EEG signals by sequence area obtained by using moving window of smallest size on magnetic IMFs can provide good detection performance for rule-based detection of the epileptic seizure from EEG signals. And time frequency image representation makes possible to compute histogram-based features for each sub-images or EEG signal corresponding to the frequency bands of EEG signal terms. The histogram-based features are effective for automatic sleep state classification from EEG signals. The classification results indicated that the Morlet wavelet kernel function of multi-class support vector machine classified had provided 92.93% accuracy sleep state classification from EEG signal. One of the important point here is time frequency image that actually opens new door of the applications these days. Like deep learning, convolutional neural network, where you want to have signal in the form of image. So this is the tool time frequency image which helps you to convert signal into time frequency image, signal in the image form, and then it can be used with advanced machine learning techniques. So the mean standard deviation of the equivalent distance based on 3D phase space reconstruction of subsignals can be useful to measure the emotional changes of the brain. The classification results have shown that the Morlet wavelet kernel function of multi-class classified vector machine classified with CL multiwavelet can provide 91.04% accuracy for classification of emotions from single channel EEG signals. Thank you very much. So, if you have any questions, please feel free to ask. Yeah, Professor Rahman, you are not audible. Not audible. Professor Aman, not audible. You are not audible. No.
Hello.
Yes, yes. Now it is audible. Yes.
Okay, sir. Thank you.
Thank you. Thank you.
Actually, sir, your topic session was very interesting. So many questions are there. So, sir, first, sir, one Neha is asking, how can you select the important portion of analysis from the whole EEG signal? Because EEG is a big signal and we have a limited memory machine. I
That
think
is
that
actually a very good question. Like you have EEG signal, now which part of the EEG signal should be taken for, and other way, how do you ensure that whatever part of the EEG signal you have taken, that has diagnostic information, that has
yes.
information for the sleep state classification or motion detection. So that is actually based on the talent. That is why this scale-based concepts are coming. Scale. So we are looking signal at different scales, and we study all of them, and we find out that particular scale is giving better result. That in that way we select multi-resolution analysis. So we select with all possible scales, and then based on the study, we say, oh, this particular interval is suitable for diagnosis.
So, sir, basically, after scaling, then we are able to see that where are the more hikes and amplitude change. Then only we are able to detect.
No, that is actually height, that is wavelet concept.
Yes.
Scale means scale like length. So
Yes.
trial and error, we take higher length, then a smaller length, like that.
Okay.
Length. And we find out, like one work in, I have used window size, which is already studied. And
Okay.
this particular window size gives you the better performance. That
So,
is, this means it has all information required for diagnosis.
sir, what is this optimum window size, sir, when we are
Yeah, that is actually so optimum window size. Uh, that depends. That actually based on the trial and error. You have to study it and you have to find out which window is suitable for. And so for next time, that will become rule. So this is one way. This is window based approach. But when you use skills like a wavelet transform, then actually each scale will give you different duration of the component, that significant duration. So from that scale also one can find out which scale is better. So according that, that particular duration also can be used for the further study.
this is more or less a trial and error?
Yeah, can.
Sir, another sir, question.
Depend like depends sometimes study also, like we go to restaurant, there are many spoons are available, and according to requirement we take that particular spoon. Similarly here also, so it depends on the nature of the problem, and accordingly actually we sometimes we do window based analysis, sometimes we do scale based analysis, sometimes we do frequency based analysis, time
Okay.
frequency based.
Okay. Sir, another question. from Krishna. Can you go to the slides where TFI signals generation is explained?
TFI image.
Yes, sir. TFI signals generation. Krishna, can you specify? Is it correct?
So actually you have EEG signal, and from EEG signal you compute time frequency representations and using smooth pseudo Wigner-Billy distribution. That gives you energy as a function of time and frequency. So energy is a positive quantity which can be converted into intensity of the image. So from that time varying energy, energy is a function of time frequency which can be converted into image intensity as a function of time frequency. So that we call time frequency.
Okay. Another question from Neha. What did you say about images of EEG signal? Could you please repeat that?
These images actually these days, new direction of research is coming, where we want to have signals in the form of image. For example, now you have convolutional neural network where input should be given in the form of image. So the time frequency and image is actually a tool where you can convert this one-dimensional signal into image form, which we call time frequency image. So the CNN also can be applied to one-dimensional signal by using this time frequency distribution concept, where this time frequency energy can be converted into time frequency image.
Okay, sir. From Mukund Lal, he is saying, sir, in 2013, the window was selected by trial and error method. Can the window selection be adaptive or automatic?
Yeah, that is actually now this whatever methods we do. Earlier we used to do with the window, STFT, all these things. Now all methods are based on automated decomposition. So based on the intensity mode functions, IMFs, so different concepts are coming now. Now this is actually old work that I have presented, but these days nobody is looking for the windows. People are going on the scale concept, which IMF is better, which rhythm is better, like that. So this is actually little bit I have presented my old work. Just I wanted to present actual problems to the participants so that they can work on them. So the purpose of this talk was to show you the applications of signal processing, machine learning, and various places where we do EEG analysis and classification.
Sir, another question, sir, from Ram Niwal. If we decompose EEG signal in different frequency bands like delta, theta, alpha, now which frequency band pattern tells us or differentiate the normal or abnormal about different subjects?
That actually that after study we come up with this kind of study that alpha rhythm is giving better discrimination, theta rhythm is giving better discrimination, and then we interpret them why this is happening like that. So first we have to separate each rhythm, then we have to study for the classification problem. And like in case of epilepsy, if you compute all rhythms, delta, theta, alpha, beta, gamma, in all rhythms energy is higher. These all rhythms are dominant in case of seizure. In case of normal, their energies are low. So because there is a presence of all frequency components in the EEG signal that is due to spikes. So the energy goes to all frequency components. So it depends on the problem. And like for example, we have studied effect of Hare Krishna Mahamantra chanting on EEG signal. So this alpha rhythm is becoming very dominant.
Okay.
Energy is higher. So then actually it means that it is bringing peace in your mind. So first we study, then we interpret them.
Okay. It's very interesting topic. I think any other question which is I think there is no question. Even sir will come in second session also. If you have some more questions,
So
we
what
can.
second session, what I will do, I will cover ECG signal processing and signal processing machine learning for ECG and various diseases. We have performed diagnosis, developed methods, diagnosis techniques. So that will also give you opportunity to explore various signal processing technique, machine learning. And also whatever you have seen here, it is single channel based EEG signal processing. Since
Okay.
62 hours time, so I will also include multi-channel EEG signal processing techniques also.
Okay. So thank you, sir,
Thank you very
for,
much. Thank you.
for
Thank you.
this wonderful informative talk, sir.
Thank you. Thank you very much.
Nice
Professor
session.
Rahman. Thank you, participants, for attending this talk. Thank you, everyone.
So we will come back to all the participants. We will come back at 3 o'clock. From 3 to 5, we have another session on ECG. So we meet at 3. Thank you.
यहाँ से पहले स्टॉप करना